Good evening, and welcome to the April 27, 2020 meeting of the Muskogee City Council. Before we begin, I'd like to give a brief reminder to my colleagues on the council. As we engage in our discussions to do the business of our city, it is important to remember that while we are here representing our citizens, we are guided by our own rules of decorum. Those rules are intended to create a forum where voicing differing ideas and concerns allow us to make the best and most informed decisions we can on any given topic. Specifically, the rules state, number one, we may disagree, but we will be respectful of one another. Good evening, and welcome. Number two, all comments will be directed to the issue at hand. Number three, personal attacks and inappropriate language shall be avoided. Each person's opinions and ideas are valuable, and their right to present them shall be respected. We all want to do what is right, so let's make sure our discussion keeps these rules in mind. And with that, I will ask everyone to stand for the invocation by Council Member Jamie Stout, followed by the flag salute.
Please join me in prayer. Dear Heavenly Father, thank you for this day. Thank you for the blessings that you have shown us, Lord. We just come to you this evening and ask for your protection over our nation, our state, and our city, dear Lord, as we go through this COVID pandemic. Dear Lord, we just ask you to show us the healing of our nation, state, and city, dear Lord, and we just ask you to wrap your arms around our healthcare workers, our first responders that are fighting the battle daily for us. Dear Lord, we just ask you to be with us as we conduct our city business tonight, dear Lord, and may we do everything to glorify you. And I ask this all in your name. Amen.
Amen. Thank you. Attention, salute, pledge. I pledge allegiance to the flag
of the United States of America.
And to the republic which is
one nation, under God, indivisible, with liberty and justice for all.
Thank you. And if we could have the roll call.
Mayor Janie Boydston.
Here.
Deputy Mayor Derek Reed.
Here.
Marlon Coleman.
Here.
Ivory Van.
Here.
Jamie Stout.
Here.
Evelyn Hibbs.
Here.
Alex Reynolds.
Here.
Stephanie Morgan.
Here.
Tracy McGee.
Here.
Well, if I counted right, we're all present in one form or another. And I would ask that if you've had a time to read the minutes of the City Council special call meeting of April the 6th, 2020, and the regular session of April 13, 2020. Does someone want to make a motion?
Marlon Coleman, I move for approval.
Evelyn Hibbs, a second. Okay. Roll call, please.
Tracy McGee.
Yes.
Stephanie Morgan.
Yes.
Alex Reynolds.
Yes.
Evelyn Hibbs.
Yes.
Jamie Stout.
Yes.
Ivory Van.
Yes.
Marlon Coleman.
Yes.
Deputy Mayor Derek Reed.
Yes.
Mayor Janie Boydston.
Yes, and the motion carries. The consent agenda contains items 1 through 3. Is there anything anybody wants to move to the regular agenda?
I move to approve the consent agenda.
Okay.
This Councilor Stout.
Is there there a second?
Counselor Coleman, I second.
Okay, any discussion? Roll call, please.
Tracy McGee,
Yes.
Stephanie Morgan,
Yes.
Alex Reynolds,
Yes.
Evelyn Hibbs,
Yes.
Jamie Stout,
Yes.
Ivory Van,
Yes.
Marlon Coleman,
Yes.
Deputy Mayor Derek Reed,
Yes.
Mayor Janie Boydston.
Yes, and the motion carries. Item 4.
Receive report on the COVID-19 pandemic in Muskogee, and if necessary, take appropriate action to authorize and approve a subsequent amendment to Resolution Number 2801, declaring a local emergency, or City-County Joint Resolution Number 2803.
Mr. Miller.
Thank you, Mayor, members of the council. This has obviously been a very important time in the history of our city and how we're reacting to this health crisis and the economic crisis that follows. We have, in the past, adopted a joint city-county resolution and a local emergency declaration. And tonight, we're going to receive some reports from the people here in Muskogee that are on the front lines dealing with this crisis. I want to start off with our emergency manager, Tyler Evans, to present.
Okay. Mr. Evans, are you there?
Yes, ma'am. Good afternoon, Ms. Mayor, members of council. As of today, Muscogee County currently has 26 positive cases of COVID-19 and 4 deaths reported to us as of this morning by the Muscogee County Health Department. This number has remained the same since the 19th of this month. The city of Muskogee remains at 13 positive cases, 3 deaths, and so far 9 recoveries. Tonight we have representatives from the Muscogee County Health Department, St. Francis Muskogee, the VA Hospital, and Muscogee County EMS. They're here to give you an update for the respective organizations. With that, I'd like to introduce Doug Walton from the Muscogee County Health Department to give us an update. Mr. Walton, are you with us, sir?
Yes, I am, Tyler. Thank you. And thank you, Mayor and council members. Some of you know the Muscogee County Health Department operates at the local level, but also under the Oklahoma State Department of Health. As the public health agency serving the city, the county, and the state, we are filling many roles throughout the coronavirus pandemic, like our close partners and stakeholders, some of whom will also be speaking with you this evening. COVID-19 is a virus identified as the cause of an outbreak of respiratory illness first detected in Wuhan City, China in 2019, has since spread globally into a pandemic. Symptoms include fever, cough, and shortness of breath. While roughly 80% of cases report mild symptoms, some progress into severe pneumonia and multi-organ failure and can lead to death. Current data indicates the risk of death for those contracting COVID-19 notably increases for individuals above the age of 60 or for individuals with underlying medical conditions such as chronic lung disease, severe asthma, heart disease, compromised immune systems, severe obesity, diabetes, and chronic kidney or liver disease. One of the primary functions of the health department has been to conduct testing of community members and first responders using nasal swabs to collect samples, which are then sent to the state's public health lab in OKC or to the OSU lab in Stillwater. As I've mentioned previously, we remain limited in our ability to conduct widespread testing due to insufficient supply of materials throughout the state and the nation. But we've conducted regular testing since the first drive-through event at Honor Heights Park on Saturday, April 4th, and daily at the health department starting on April 9th. Through today, we've collected 283 samples for testing with only 3 positive results for COVID, and 2 of those are not residents of Muscogee County. It is important to note that healthcare providers such as hospitals, urgent care, and other clinics also collect samples for testing. Tyler reported today to Muscogee County, including all municipalities, we've had a total of 26 confirmed cases of COVID-19, 20 of whom have recovered with 4 fatalities of Muscogee County residents, and we're very sorry for their families and loved ones. Another primary role of the health department is contact tracing. This is the investigative process our public health nurses use to reach anyone with a confirmed case of coronavirus to notify them about the need to isolate themselves, and to notify those who they may have been in close contact with, meaning within 6 feet for more than 10 minutes, anytime, including 48 hours prior to symptoms. Some of you are aware the State Department of Health regulates long-term care facilities also, nursing homes, and we've been very lucky in our county to have had no outbreaks to date. With help from the National Guard, our nurses are working very closely with nursing homes to continue reducing chances for spreading the virus, and are ready to assist with testing staff and patients if and when any cases are detected. An additional role of the State Health Department is data surveillance, basically just keeping track of all the numbers from all the counties, plus OKC and Tulsa, which both have independent health departments. So the state has been tracking data such as number of cases, hospitalizations, deaths, and healthcare capacity. As of this morning, Oklahoma has had 3,280 total confirmed cases, with 18% of those being healthcare workers. 2,167 of those 3,280 cases have recovered, but we do still see approximately 75 to 100 new cases per day in Oklahoma. We've had 197 fatalities from COVID in Oklahoma. 80% of those who died were 65 or older, and another 15% were age 50 to 64, making 95% of fatalities over the age of 50. 67.5% of the deceased had at least one chronic condition, and the rate of weekly hospitalizations in Oklahoma peaked in late March and early April and has declined somewhat steadily since. In order to open up and recover safely, the health department does stress the importance of several important precautions for individuals and businesses. Continue to maintain a distance of at least 6 feet from others whenever away from home. Wash your hands frequently, especially before and after touching your face if you have to, or before and after eating. Wear a face covering whenever in public. Stay at home as much as possible if you are over 65 or have any underlying health conditions. Definitely stay at home if you're sick, and call 911 if you need immediate medical attention. Tyler, that's all I've got.
Thank you very much, Mr. Walton. Are there any questions for Doug from the Health Department?
Yes, Ms. Mayor, this is Councilman Ivy Van. May I be recognized?
Yes.
Yes, Mr. Walton. On those 200-some cases you said you tested, are they the ones that come and say, well, we think we have it, or do they have it?
Yes, Counselor. Basically, the criteria for testing is that they need to be over age 16 and then either have a fever of 100.4 or a cough or shortness of breath or have been in close contact with a confirmed case. And if any of those conditions are met, then they are eligible for the testing that we have available through the health department.
So if they're not in that condition, and I'll give myself an example up here tonight, and I don't show symptoms, which all around the country people have this virus without symptoms. So you're telling me that you only tested 200-some people. We got 40,000 here in Muskogee. How many tests do you have there at the health department right now that you can test somebody?
How many sample kits available for testing, sir?
Yes, sir.
We received an additional 7 sample kits in this afternoon for use tomorrow, and that's been the case pretty much ongoing, that we get a few each day. Sometimes we get a larger batch, 30 to 40 at a time, that we have to spread out over the week, and that's the main reason we haven't been able to do more testing.
So what you're telling me is, right now you say you have 7. If 40 people broke out with it right now, and another example is that my example I gave you just a while ago, if people don't know they have it, you don't really have the test. If 100 people came right now, 50 people, 25, you don't have the testing material to do it, right?
That is correct, sir, and it is a problem. We've definitely acknowledged it all along, that we just are limited in our ability to really do the testing that is needed because of shortages of either the swabs or the sterile media that the swabs go into once they've been collected, or the reagents that are used in the labs for actually running the tests to determine if it's positive or negative. And so all of those things have been in relatively limited supply and within Oklahoma, within the nation.
I want to thank you, Mr. Walton.
Unfortunately.
I want to thank
you,
Mr. Walton, for your report. That tells me what I need to know, because like I say, I think we don't have proper testing, and we've dropped the rules tonight, which they'll probably we'll probably reopen. But I think it's a bad situation when you don't have enough tests to test people here in Muskogee, and that's just me. But until we get people tested, but that don't have the symptoms, which I know it's a lot of people probably around Muskogee that don't have the symptoms that do have COVID-19, is what I'm saying to you. But I just want to make sure how many samples the health department had in case 40 people broke out right now with it tomorrow. But you've answered my questions for tonight, sir.
Actually, I think I might have misspoke, because I just got a text. I was wrong. We have 7 scheduled for tomorrow. We received 40 tests this afternoon for tomorrow, and then for several days remaining this week. Sorry for the correction.
So you got 40 tests scheduled for this week?
No, 40 kits.
40 kits.
We received 40 kits this afternoon, and we have 7 that have called and scheduled for tomorrow. Our numbers have somewhat declined. We've been doing average of 12 to 15 a day. And just in the last couple or 3 days, we've had a little bit less on the scheduling, yes.
I know you said your numbers have declined. You just got through saying that. But that's because nobody's coming there with the virus saying that they have it, and you confirmed that they have it. But the 40 people right now, or 50, for example, coming there that want to be tested, they can't be tested. You got to show samples, correct? Signs of having the virus. Am I correct?
Yeah, I think you are correct. If I understood what you said, if they have one of those criteria, the symptoms, or have had close contact with a confirmed case, then they would be qualified for the testing. If we have the tests in, that is correct.
Okay, I just want to get a good understanding on that, Mr. Walton. Because like I say, it's a lot of people around here probably in Muskogee that have it but can't be tested because they don't show signs of it. But I appreciate you for your report. I'll turn the floor back over to you, Ms. Mayor.
Thank you. Tyler, you got somebody else to talk?
Yes, ma'am, I do. I had the VA here and both St. Francis trying to dial in. It looks like both of those organizations had issues that came up, so I'm going to give a quick update of what I do know on their behalf, if they don't mind. The Veterans Affairs is still performing screening at their location. They're on Honor Heights Drive. They plan to do that probably until the next week or so. Obviously, they get their direction from the federal level, in the national, the VA level. St. Francis Muskogee, some good news. We plan to demobilize and deconstruct the tents that's outside their facility tomorrow morning. That's still planned. Just confirmed that about 30 minutes ago. So that should tell us something that they feel comfortable with their number of equipment and beds that they have at St. Francis Muskogee, that they feel comfortable demobilizing that tent. As we said, they're watching the numbers steadily decrease, and they've been closely watching the hospitalization rate over the past couple of weeks, and they feel comfortable making that move. So myself, Muscogee County EMS, Muskogee Police Department, and Muskogee County Emergency Management will be assisting St. Francis with taking those tents down tomorrow morning. Our last speaker is Trish German with Muskogee County EMS, so I'd like to introduce her to the microphone. Mrs. German.
Okay.
Good evening, Council. As of today, for this week of 4/19 to 4/26, Muskogee County EMS calls are running about 367. We are down about 75 to 85 calls from this same exact time last year. Our refusals are also down quite a bit, only 75 refusals this week compared to what we've had in the past weeks. Call volume, out of those 367 calls, We've only had like 6 people that have actually called and said, hey, I've got shortness of breath, fever, cough, situations like that. So EMS, we are still continuing to wear our masks on every single call, wearing our PPE, taking body substance isolation precautions. We're continuing to fog all of our trucks that we're supposed to, as needed, and all of our stations. Does anybody have any questions?
I would like to have a little explanation about the refusals. Exactly what does that mean?
So a lot of times patients will call in for some sort of symptoms, what's going on with them. A lot of times, now in the past few weeks, we've noticed that people are just refusing to go to the hospital. They don't want to go to the hospital. The medics are spending time on the call trying to get people that are really sick that need to go to the hospital, but they're just like, oh, absolutely not, I don't want to go. Now the refusals, we're not getting as many refusals as we were in the past weeks. People are realizing, hey, this is a true emergency. I need to go to the hospital, whether it's something either diabetic related, cardiac related, or even trauma related. They're realizing that, hey, this is a 911 call. This is an emergency. I need to go to the hospital.
Okay, thank you very much.
Thank you.
Mayor, this is Councilman Coleman. May I ask a question, please?
Go right ahead.
I want to be certain when Mr. Walton was making his presentation, did I hear him state that there are no cases of COVID in any of our nursing homes in Muskogee?
Hello, Counselor. I can reply to that if you like.
Yes, please.
Good.
No, actually, we haven't had an outbreak of the nature that we've seen in other counties with multiple patients and or staff getting sick. I believe currently there is one facility that has had 1 or 2 cases, and may have been one actually where they were resolved, where there was a recovery, but very, very limited to date in Muscogee County. That is correct.
So for education purposes, what is actually, for nursing homes, what is considered an outbreak?
Well, it would be more of the case where you had, and actually, I can only give you sort of a lay explanation. I am certain that those nurses and the epidemiologists who work with the nursing homes probably have a better answer for you on how they would define an outbreak. But what we've seen in other counties, for example, Delaware County has one nursing home with 80 cases with about 50 of patients and I think 30 staff. We've been really fortunate to have nothing like that in Muscogee County, where we've only had 1 or 2 homes with 1 or 2 cases that have been contained without spread beyond those.
Thank you. And then my other question and my last question is, and Tyler, you may tell me that we're going to discuss this later on, but one of my concerns is that as we see fewer people requesting to be tested, and we're doing that in parallel to starting to reopen in phases, I'm wondering if we should do some type of education campaign to let the residents know we're not reopening because we think we have the cure, and so they need to still get tested as much as possible as some sort of education campaign. We may talk about that later, but I just thought I'd bring it out there. And that's all I have.
Well,
Yes,
I'm
sir.
hoping we continue the mitigation efforts anyway for as long as we can.
Ms. Member, everybody recognized?
Yes, go right ahead.
This question could be for you, Mr. Walton, or you, Mr. Evans. On our nursing homes, how many nursing homes we have in Muskogee, would you know?
Not off the top of my head, no.
Just kind of, well, guess, how many people do we have in the nursing homes?
A couple of hundred.
200, 300, 300?
Uh-huh.
Well, you really can't test them unless you go test them, but they got to have symptoms. They could be landing in nursing home still, just like I said before, that they could have, without having symptoms. They could still have it. It'd be, for our middle age like that and high risk, it would be good if we did have the test, that the health department could go to each nursing home and test the people. That would be a great thing to do here in Muskogee. That's my idea.
Well, and I think we all agree with that, Mr. Van, 100%. But the issue is getting the test kits. Period. Our Muscogee County Health Department's not to blame. They're getting their materials and equipment from the state, and I don't want to say the state is to blame either, because they're limited on the number of testing that they have. One of the biggest issues that we had a couple of weeks ago was we had test kits, but we didn't have the reagents for those test kits. So while we could test people, we couldn't actually complete the test because of the reagent material. We were lacking that at the state level. So yeah, I would 100% would love to be able to have enough tests to test everybody in the city that wanted to be tested, our nursing homes and everything else. But we're just simply not to that level yet. And we're not to blame. The county health department's not to blame. To be honest, I don't know where to point the blame at for getting those test kits in. But I'm hoping as time goes on, our hospitalization rate goes down, and maybe they get some better testing in here that we can do that. Because we've discussed the quick test, the 20-minute test, and we've heard they got a 30% inaccuracy rate. Well, a false test doesn't do you any good. If the test is bad and it says you have it or you don't have it, I'd rather have no test than a bad test that told me something wrong. So until we get that under control and we start getting some reliable testing in here, I truly believe the health department is doing the best they can with the resources and limited resources and manpower that they currently have.
I believe they are. like I said, I think you only can do the best you can do.
Correct, and I think they honestly,
all we can do is the best
full
we can
intention,
do.
they're doing the best they can do with the, like I say, limited resources they have.
But I just wish we had more testing here so we could find out exactly,
Me too.
How many people, I'm not trying to say the health department. I think you're doing a great job, Mr. Evans.
Thank you.
The health department is doing a great job. I just want to get that a good understanding. They all are doing a great job. But I'd just like to see more testing here done in Muskogee. For when I look in the paper, I keep seeing 26, and
Right.
deaths. That's it because of that testing. But I'll turn the floor back over to you, Ms. Mayor. I'm sorry.
Thank you. If anyone has any other questions, it seems that we need to decide if we're going to take appropriate action to authorize and approve the amendment to resolution number 2801. Mr. Miller, are you ready to
Yes, ma'am, I am.
talk about that?
Yes, we do have two
Okay.
items. You're right, there's kind of three things in this agenda item. First is receive report, which is the discussion that we've just done. And then we have the joint city-county resolution 2803 and the local declaration of emergency. I do think maybe we'll start, if you guys don't mind, talking about the joint city-county task force that has made recommendations to modify the city-county joint resolution. We have three members of the council, the mayor, Councilor Stout, Councilor Coleman, that were all part of that task force. And I'd be happy to let each of you or any of you address sort of a report out from that task force. And then Mr. Tucker has done a great job, as he usually does, turning ideas into actionable legislation, and he'll kind of explain the proposed joint county resolution amendment. But I'd like to turn it over to members of the task force now to give a report out if they'd like.
This is Councilor Coleman. I was going to say that I think that Mr. Tucker can probably, in his presentation, explain as well as we can what we discussed.
Yes,
This is
and if he's
Councilor
ready. Councilor Stout, did you say something?
I was going to say, I agree with Marlon. I think Roy has the information. He can make the presentation for us.
Okay, I'm the third member of that task force, and I think that would be a good idea. So, Mr. Tucker, if you would give us the details of the amendment.
Absolutely, Mayor. Members of council, happy to do it. The task force that we're talking about, which is the Joint City-County COVID-19 Task Force, met on Thursday to consider the Governor Stitt's plan to reopen Oklahoma. He's titled that plan "Open Up and Recover Safely: A Three-Phase Approach to Opening Oklahoma's Economy." So the acronym for that is the HOURS plan. And in recommending adoption of the plan, the task force reviewed all available data from the county health department as well as the state health department. We talked with, or we received information from local hospitals as well as information from our city and county emergency management directors. And what the data shows, which Mr. Walton went through some of which, shows that Muscogee's cases have remained at 26 for 9 days now. We recognize that there are 4 deaths, but we also recognize that 20 of those 26 have recovered. And when that data is drilled down to the city level, those numbers show 13 cases within the city, 3 deaths, 8 recovered, with 2 cases of infection remaining. When you broaden that scope and look at the data at the state level, there were, according to the resolution, 3,017 cases, 179 deaths. That data is actually from the 23rd of April. So there's a slight change in the wording of the resolution. The data from the 24th shows 3,121 cases, 188 deaths, with 2,139 recovered, leaving 794 infected. Now, the latest information that we got was from our meeting this morning, and I did want to relay that to you. It's not part of the task force because we'd already made our recommendation, but just to kind of put things in context. As of this morning, there were 3,280 cases, 197 deaths, with 2,167 recovered, leaving 916 infected. Hospitalization rates and new infection rates are in decline. There is a graphic on the resolution which demonstrates the hospital decline. It's on page 2 of the resolution. And for those who may be watching at home, the proposed resolution has been uploaded to the city website under latest news, so you can follow along with us. So if you'll look, the significant peak that we reached was between the weeks ending March 28th and April 4th. And then after week ending April 11th, the statistics and hospitalization showed a decline. New infection rates have also slowed. We had 60 new infections per day 2 weeks ago. Now we're down to 27 this week. All available data that the task force reviewed show that the state and indeed the city and the county have passed the peak. So as a result, the task force is recommending adoption of the second amended joint resolution 2803. I will say that you all know this is a joint resolution, and so the Board of County Commissioners of Muscogee County took action this morning to adopt this version. So the meat of the resolution, if you will, adopts Governor Stitt's 3-phase approach. And what that allows for in phase 1 is opening of personal care services as of April 24th by appointment. So that's dog grooming, barbers, salons, nail salons, and the like. Most other non-essential businesses will reopen in May 1, and that's all part of phase 1. Moving on to phase 2, bars and businesses which provide funeral and wedding services, as well as children's nurseries in churches, can be open on May 15th, and all restrictions will be lifted on June 1 as part of phase 3. The resolution continues the requirement that businesses which are going to reopen within these timelines submit a mitigation plan or answer the business questionnaire prior to reopening. I'm very happy to announce that so far we have received a total of 765 plans on file for the city only. That does not count the plans that were submitted by the county as well. So what that tells us is everybody's taking this seriously. And the plans that come in come to an email address that comes to me and 2 other people, and we review the plans as they come in. And I will tell you that in probably 98% of the plans that we've reviewed, all of the CDC guidelines are being incorporated. If we're talking more specifically about the businesses, barbershops, hair salons that opened up on Friday, the State Board of Cosmetology submitted its own more strict rules. And so those salons are required to have those in place, or a complaint can be made to the State Board of Cosmetology, and also law enforcement can shut down a salon if they fail to adhere to the state guidelines, and those are under their rules, not necessarily ours. So we've been very pleased with our response on that, and we think that our businesses have taken a significant investment in the health of its citizens as well as its employees, so we're very pleased about that. And so this resolution does not affect that. This amendment to this resolution does not affect any of those requirements. So with all that being said, even though we're recommending, the task force is recommending adopting the governor's plan, we've also advised within the plan that citizens remain vigilant for very many of the reasons that Councilor Van has expressed, that we have a number of people who can be asymptomatic throughout the entire time and could, in fact, infect someone who may not also be asymptomatic, who may ultimately get some of those symptoms as a result. And so it's important to note that moving from the different phases requires certain measurements to be maintained, and specifically in accordance with the governor's plan, which we are recommending be adopted, are that the hospital and incident rates remain at a manageable level for 14 days between phases. And so those will continually be monitored. So we're also recommending, and the resolution recognizes this, that citizens should avoid unnecessary travel. What have we said all along? Stay safer at home. And that rule still remains in effect. Continue practicing social distancing. Wear masks when social distancing isn't possible, such as elevators or cars or places like that. And continue frequent hand washing and sanitizing of surfaces. It is up to us to do our due diligence to make sure that even though our recommendation is to open up Muskogee and open up many of the businesses, that we maintain our vigilance in taking care of ourselves and our fellow citizens. And so that warning is contained still within that resolution. So vigilance, of course, it must be maintained so that we don't have a reemergence of the COVID-19 infection. So with that, I'm happy to answer any questions, but I will say that the recommendation of the task force is to adopt the second amended resolution, which does incorporate the plan of Governor Stead.
Okay. Do we have anyone wanting to say anything?
Yes, Ms. Member, I recognize.
Yes.
I appreciate the council when I brought the item for you in March, Roy, you joined it up about the bars, business, and those salons and all that. And the next day, I appreciated the governor with the barbers, and the hair salons. I appreciated him. But I'm kind of leery right now because when I see a governor that writes the president a letter about it all, how it's down right now, and this governor says coronavirus is an act of God, I have a problem with that. When I have a president that tells me that you can take a Lysol bottle and use it, I got a problem with that. That's our top leadership that's telling us these things. So I have a problem with that. But I believe the task force has done a great job, and I appreciate them. But I still say, in my personal thought, that it's still coronavirus is here in Muskogee because we don't have the test. And I'm very disappointed in the president for saying what he said. And I'm very disappointed in what the governor wrote him a letter, saying what he said, because it wasn't an act of God. It started in China. That's what Mr. Walton just got through saying just a while ago. So when people say some things like this, I'm not a professional person. I'm not the president. I'm not the governor. But common sense rules a lot over any other sense. So I'll say that to say this. I just like I say that those two things right there really shocked me. So, but I thank the task force for all your hard work because I know y'all definitely you work hard. So I'll turn the floor back over to you, Ms. Mayor.
Thank you. If we want to adopt this amendment, we're going to need a motion to do so.
This is Councilor Stout. I move for approval.
All right. Is there a second? Hibbs, second. Okay. Is there any further discussion? Roll call.
Tracy McGee,
Yes.
Stephanie Morgan,
Yes.
Alex Reynolds, Alex Reynolds, Evelyn Hibbs,
Yes.
Jamie Stout,
Yes.
Ivory Van,
No.
Marlon Coleman,
Yes.
Deputy Mayor Derek Reed,
Yes.
Mayor Janie Boydston.
Yes, and the motion carries. Item 5.
I don't think, Mayor, may I interrupt? I don't think we're quite ready to move forward yet. We do have a proposed Third Amendment Resolution 2801, which we are putting before the council, which also needs some action. Proposed third.
Okay.
All right, if I may.
Uh-huh.
All right. Proposed Third Amendment Resolution 2801. I did email out to the members of the council and then passed out a hard copy to those who are here. Additionally, that has been uploaded to our website under latest news for those who are at home who wish to follow along. This proposed amendment makes modifications to our originally declared local emergency. It establishes the authority for the city manager to make a plan to reopen city facilities. As you may remember, the original iteration of this plan authorized him to close public facilities and city facilities. So in turn, this grants him the authority to make a plan to reopen it. It also recognizes the plan for reopening the city as was just adopted in Joint Resolution 2803. And the reason that was necessary because under the prior iteration of the ordinance, we had closed restaurant, dining rooms, and museums and bars and things of that nature. So we had a bit of a conflict there, which we want to clarify with the adoption of this resolution. Additionally, the proposed resolution also reinstates the purchasing procedures, which had been suspended since March due to the need to combat the COVID-19 pandemic. And then finally, and most importantly to the citizens probably who are watching, is that it also deals with utility accounts. As you may remember, we had issued the second amendment to the emergency resolution, which permitted us to suspend cutoffs for a period until April 30th. And so this proposed resolution will extend that period beyond that to May 22nd, but will also include the provisions for requiring a pay plan to get those customers who are delinquent due to COVID back on track. And at this time, I'm going to turn it over to Tammy Tracy to talk specifically about what that plan entails. And that plan is attached as Exhibit B to this resolution. Tammy?
Good evening, Mayor and Council. As Mr. Tucker has stated, we are going to discuss the pay plan for the past due accounts on water bills. The cutoff process for the utility accounts will resume on May 22nd, 2020. Late fees and miscellaneous charges for those accounts will also resume on that same date. With that being said, no late fees will be assessed on balances that have accrued during the COVID-19 emergency time frame. That time frame is any utilities charges accrued between March the 23rd through May the 21st. At that time, if you feel that you need a pay plan for these past due balances, you are encouraged to call the Revenue Department to set up that pay plan. It must be the account holder that contacts the Revenue Department, and we will authorize a 90-day pay plan. That's all. What that equates to is about 3 billing cycles. The balance that you've accrued during that time will be put on a pay plan that is broken down into 3 payments. Those due dates will coincide with the current bills that will be coming due, and that will allow you to pay those past due balances while keeping your services in order and no interruption of service. However, if you fail to make that pay plan, that could result in the interruption of services. So we are encouraging everyone to contact the Revenue Department as soon as possible to get that set up. We will mail you, we will mail you a copy of that pay plan with the dates. If you have any questions, wondering if you're eligible, if you'll just give them a call, they'll be able to help them. I'll be happy to answer any questions.
Okay.
All right, Mayor, I believe at this point we need some action to adopt, or if that's what the will of the council is, the third amended resolution 2801.
Okay. What is your pleasure?
I had a question, Roy. Councilman Tracy McGee.
Yes,
you said
go
something.
right ahead.
Thank you. You said something about bars and restaurants. That was can you explain that?
Yeah, of course. In the this is the third amended resolution. In the second amended resolution, we had a provision that closed bars. And so that provision has now been removed in favor of the plan that was adopted in the joint resolution.
Gotcha.
So thank you for asking that.
Okay. And that's just going with what the state recommended, correct?
Absolutely.
Gotcha.
Okay. Anything further?
Mayor, this is Councilman Coleman.
Yes.
On the plan that the city manager is going to develop, Mike, when do you think we'll see that?
For reopening of city facilities? Yes. So I have some basics that I can outline now if that's the wish of the council. One of the things that we have to do is cross-reference the governor's order and the CDC guidelines and make sure we're following both, because the governor's order says do these things as long as you are following CDC guidelines, and those guidelines include certain number of people, events, social events of less than 10 people, social events of less than 50, social events of less than 250, and those are at various stages as well. And so we're working on cross-referencing those. We have two different scenarios. One is working with the Civic Center and their rooms that they rent out. We have a meeting tomorrow with Martin Luther King Center Trust to discuss how they're going to proceed. So those venues that their whole job is getting people together in certain places at the same time, they are going to have a challenge going through this, because a lot of these are saying, yes, you can open, but only under social distancing policies. So that may limit the possibilities. The things I can tell you about are related to parks. We're looking at phase one, which is for a May 1st timeframe to reopen. Relates to swim and fitness center, reopening that day, teen center, Hatbox Sports with practice facilities only, not games, but social distancing for players and spectators. Trails will continue to be open, but playgrounds, splash pads, and restrooms will not open on May 1st. And we will not do facility rentals on May 1st. So indoor-outdoor reservations will not be available on phase one or phase two. So that's what we're looking at for May 1st. Also, May 1st, we're getting some additional guidelines from the CDC on parks specifically. So we're looking forward to that. That may help inform us on other phases. So that we may ask, well, what does that leave us? We're still looking at places like our splash pads, playgrounds, park restrooms being more of a June 1st opening. At this point, again, we're going to wait for more CDC guidance. Our senior center would be more of a June 1st or later. Water park and the Spalding pool would be June 1st. or later. Again, all these are phase 3 sorts of things, and those phase 3 again is contingent upon phase 1 having good results for 2 weeks, phase 2 having good results for 3 weeks. So these timeframes, of course, may move back depending on the health outcomes in our community. But those are sort of the general things that we're looking at. We understand that these activities are near and dear to a lot of people, but we also understand that we want to follow CDC guidelines and we want to follow good safety protocols. And so the facilities that we do open, we do have guidelines on social distancing and limiting class sizes and those sorts of things, so that people are able to participate in these activities in a safe way that's recognized by the CDC as appropriate.
So on parks, we don't have a definite date. We're just waiting to see what the guidelines may be, and then you'll come back with us with what that date might be, because I'm concerned that we may be opening parks too soon.
So our thoughts right now are not to open playgrounds, splash pads, park restrooms until phase 3. That's our understanding of the best practice guidelines as of today. The governor's order opens gyms as of May 1st. And so us following that has us opening swim and fitness on May 1st, and following those guidelines as we're recommending the public. It also has social distancing guidelines if you do open that sort of business, and so we are making sure that we're going to practice that as well. I don't know if that answers your question. So we do on May 1st, we are following the governor's plan and opening 3 different sorts of activities: swim and fitness center, teen center with social distancing and limited class size, Hatbox Sports for practice. Because we can keep people spread out during practice. You don't all have to get in the dugout at the same time during practice. So those are all outlined as outdoor. That's outlined as an outdoor venue, outdoor sports venue in the governor's plan to open May 1st. And so we're following that recommendation as well. Again, with social distancing guidelines in place.
Does it have anything about masks in place?
I'm sorry, I'm not sure I understood your question, sir.
Does it have anything about masks in place? You go in these places, you want a social distance?
Yes. So the general CDC guideline is in instances where social distancing is not practicable, then you do have masks, and you do recommend masks. I have not gone through when I talked about what we're cross-referencing with all the CDC guidelines and number of people and kinds of facilities. That's one of the things that we're doing between now and May 1. And I've spoken with parks extensively today, and we have another meeting tomorrow.
Thank you, Ms. Brown.
Councilor Coleman, does that address your question?
Yes.
That addressed it, but I still like to see some numbers change before we just open up anything with water or that's going to involve direct contact with people, because I am concerned that if we do that too soon, we're going to have the potential to increase our spread.
Correct, and phase 3 is when we would consider opening up things with water, the splash pads and the pools and the water park, and by then we have to have had to get to phase 3. We don't have, the goal date is June 1st, but to get to phase 3, we have to have basically 2 weeks in phase 1 and 2 weeks in phase 2 with good numbers, as you say, Councilor Coleman. So we don't feel like we are rushing. Usually we would open up the pools and splash pads Memorial Day weekend. So this is a delay of at least 8 or 9 days, at least. I mean, it may be longer depending on the health outcomes that we see in our community.
Okay, and I get we can monitor it. Go ahead. I'm sorry.
Yeah, I'll say this is Councilor Stout Mike too. I know that I think where the Tulsa is not opening any of their city pools this summer due to the COVID as well. So that may be something we might want to look at depending on what our numbers are in the next, if they decline or increase in the next few weeks as well.
Yes, absolutely. I think Tulsa has a two-pronged approach. One is budgetary and one is health factor. And I think both of those are a factor for Tulsa and there are reasons for shutting down. But absolutely, it's our discretion. These are the time frames which we feel like that we would look at given our current status regarding health.
One thing I do like that some cities are doing, I'm not going to say Muscogee's doing this, but like, for example, the gyms, when they open the gyms, you go in there and social distance, 6 foot, and you also have a mask while you're exercising. A lot of cities are doing that. I watch a lot of CNN, but that's just an example of, but I definitely agree that definitely on those parks, I'm glad that y'all have extended the time out, because those kids are a safety, it's just, I'm glad you extended that time out.
Yeah, we're looking at playgrounds in phase 3, which is, June 1st is the goal date for that. And it could be later.
Turn the floor back over to you, Ms. Mayor. I'm sorry, I didn't recognize you had first.
Okay. Anybody else have questions or comments?
Oh, I meant to say, Ms. Mayor.
Somebody want to make a motion about this?
Yeah, this is Councilor Stout. This is Councilor Stout. I move for approval.
Okay. Is there a second?
This is Morgan. I second.
Okay. Any further discussion, comments, questions?
Yeah, Ms. Mayor, I meant to tell you, I like that statement you made when the meeting first began. And I want to thank you tonight, too, for being so nice and sweet tonight and respectful yourself also. So that's come from Councilman Ivory Van. Thank you.
All right. Any further discussion? Roll call.
Tracy McGee,
Yes.
Stephanie Morgan,
Yes.
Alex Reynolds,
Yes.
Evelyn Hibbs,
Yes.
Jamie Stout,
Yes.
Ivory Van,
Yes.
Marlon Coleman,
Yes.
Deputy Mayor Derek Reed,
Yes.
Mayor Janie Boydston.
Yes, and the motion carries. Item 5.
Consider approval to authorize the city manager to negotiate and execute a contract with Arrow Point Solar to install, service, and monitor a 300-kilowatt solar system for the Muskogee Civic Center in an amount not to exceed $480,800 or take other necessary action.
I understand we have 2 citizens have signed up to speak to this matter, and the first one is Jim Winner. I don't know if he's on the phone or in the council chambers. If you're in the chambers, you can go to the podium and please give us your name and address.
Name's
and
Jim
you have
Winter.
5 minutes.
Name's Jim Winter. I live 1205 North Edmond. And I just wanted to say on this regards to the proposed solar system contract with ArrowPoint, is this a proposed one-time cost? How many years is covered by this proposed contract? Will there be any additional costs? Is there a provision for battery backup storage facility for the unused electricity? What is the length of the guarantee? Is there a warranty? Is there infrastructure costs, solar equipment costs, hardware costs, repair and maintenance of breakdown costs? In time, does the purchased solar system become city property? That's my question. Are we leasing? Is this going to end up being a lease? If it's a lease, then it's not going to just be paid off in one payment. That's where my question is. So how long is this period of time are we talking about here? Is this a one-time takes care of all? Or is this a turnkey where we get the whole rights to the whole system? Because that's not the way they do it. As far as what I've tried to find out about solar. And anyway, should we the citizens consider a solar lease as a major purchase here in Muskogee? Do we have any competitive offers from other companies? Does a solar loan option provide a better solution to where we're at as far as what's going on with Muskogee? And is the square footage of the Civic Center, as far as the rooftop itself, adequate and feasible to put a solar system on it? And we need to be realistic about the savings, because all this has to be put in where we have an agreement with the electric company. If they do, in fact, take our extra folders and stuff, do we sell it back to them? But now, what if we have a problem? We have to store that electricity somewhere. So that's an additional cost. And I don't see that you can buy this. I've tried to just get it for my home, and this is where I ran into a problem. And then the only other thing is, if something happens to the company, you're stuck with what you bought. So that's basically all I wanted to say about it.
Okay.
Well, thank you.
Yeah, thank you.
Go ahead.
Yes, we have. Mayor, this is Mike Miller. We do, what may be appropriate now is, Mr. Winter, if you don't mind, I think Mr. Garvin's going to make a presentation in a moment.
Yeah.
And he will answer, I think, a whole lot of your questions with his presentation. And then if you have questions, we may be able to address those at that time.
Okay.
Okay, and then we have another citizen that has wants to
comment?
speak on this matter, and it's Mr. Dan Morris. I don't know if he's in the council chambers or on the phone.
Madam Mayor.
I'm on the phone. I'm on the phone, Mayor.
On the phone.
Madam Mayor, we do, Mr. Winter still has some time. I'm sorry if we can let him continue. My apologies.
When you were talking,
Mr. Winter still want to talk?
Mm-hmm. Yeah, I just need to make a comment about when you were talking earlier about the virus and everything. Is we need to make the people more aware in this town, because on the way here, Economy Drug has an outdoor sidewalk sale going on, and there were 30 people outside right there. And so they're not.
All right.
They don't want to play anyway.
Thank you.
Okay, thank you. And then we will go to Mr. Dan Morris, and give us your name and address, Mr. Morris, and you will have 5 minutes.
Okay, thank you, Mayor. Dan Morris, 3308 Monta Avenue, Muskogee. I just wanted to give you a little bit of my experience with the solar energy and also with AeroPoint. I've got a system that's very similar. In fact, it's the same size as the one that you guys are looking at doing. And it's been installed for almost 2 years. I'm a little bit jealous because I paid more money than your proposal is. So I may have to speak to them about that. But be that as it may, most of the questions, and I'm not sure, I have no idea what kind of deal the city made, but when I bought the system, I own it free and clear. And to answer some of those questions, it has basically a 30-year warranty. My payback based on the first year's results is about at 6.25 years. And there are some tax advantages involved in that as well, but it's still completely feasible. But one of the things that I really think is important for the city, and I've said this ever since I've had mine, because the publicity that it brings you is invaluable. We've actually gotten new customers because of the solar array on our roof. So it can work in construction and steel fabrication as far as getting you a good name out there. And I think it puts us ahead of some other cities when we're looking at economic development and things like that. You know, we're progressive enough that we recognize that solar is a good idea and it's practical and will save the city money. So that's all I got to say. If anybody wants to ask me any questions specifically about it, or if anybody ever wants to come and see our system, I'd be happy to show you.
Well, I personally got a chance to see some of that one time, and it was very, very interesting to me. And we appreciate your input. Does anyone have any
comment? One more comment, Mayor. Yeah. The company that did that, they actually weren't even in the solar business when I first started dealing with them. I did an LED light conversion at one of my facilities oh man, it's 5 or more years ago when they were doing LED lights, and he was just starting to get into solar at that point. But he did 2 LED jobs, and then they did the solar job. So I've got complete confidence in them and their capabilities. So that's my 2 cents.
Well, we appreciate that. Does anyone have any questions they want to ask Mr. Morris? If not, we'll ask to hear from Gary Garvin.
Mayor, members of the council, just to give you a little bit of background, last year we started looking to the possibility of a solar system at the water plant, pollution control facility, civic center, swim and fitness center, and the public library. Based on our research, the civic center was the best facility to start with. It had the largest cost savings over the life of the system and the shortest payback period. We discussed the proposed project with City Council during the budget process, and Council approved budgeting $260,000 in capital outlay to be used to purchase and install solar system equipment at the Civic Center. As you're aware, the capital outlay provides revenues to fund major projects of new equipment and cannot be used for the day-to-day operations. So, with Council approval of the budget, we prepared a request for proposal, an RFP, for the installation of a 300 kW solar system, again at the Civic Center. We did receive 4 proposals. We put together a review committee. The review committee reviewed the RFPs and determined that AeroPoint Solar was the best company for this project. AeroPoint will engineer, install, maintain, service, and monitor the 300 kW solar system. The inverters and panels, which is the majority of the system, has a 20-year warranty. Their proposal is a lease purchase, and I'll briefly go over the financial breakdown. The total cost of the system is $560,800. We did receive an $80,000 tax credit discount. So after the tax credit discount, the cost of the system was $480,800. As I mentioned earlier, we budgeted $260,000. That will be used as a down payment. That was budgeted in the capital outlay for this project. So the balance is $220,800. That is 0% for the term of the lease, which is 69 months. So the monthly payment will be $3,200. At the end of the term, we do own the equipment. The equipment is ours. The monthly solar production value or savings is estimated at $3,611 a month. Therefore, the payment, which is $3,200, is less than the monthly savings. So we can either pay for electricity or we can pay for the solar system. The difference, though, between the two is after 69 months, we'll have paid for the solar system. We'd still be paying for the electricity. So just to recap, this is a budgeted item. Payback is less than 10 years. The estimated savings to the city on electricity for this one facility, the Civic Center, and it depending on the rate increases through the years, is in between 1.3 and 2 million. The warranty is 20 years. Solar, Aero will service, maintain, and monitor the system for the term of the lease. Be glad to answer any questions. Otherwise, staff, the review committee, and purchasing committee all recommended approval.
Thank you very much. Are there any questions for Mr. Garvin? Any comments?
I have a question. Councilor Reynolds, I have a question.
Go right ahead.
Yes, sir.
Do we have a purchase price for the system? Where
The total cost.
Where we can just purchase it outright and not lease it?
We could purchase it outright. The total amount to purchase it outright at this point would be $480,800. We budgeted $260,000, and that's what we're using for the down payment. The payments again are going to be less than what the electricity would cost that we'll be saving over the term of the lease. Again, we expect to be making an estimated $3,600 in value or savings production value during that term. The payment itself is going to be $400 less than that. So we should be making less payment during that time. And again, after the 69 months, then of course that part is free. We'll still have electric bill because we are using more than what the system is producing. But we could pay for it, but that would have to be budgeted in at this next budget year.
Yes. Madam Mayor, may I also answer that question?
Yes, go right ahead.
So, Councilor Reynolds, one of the other reasons that we structured it as a lease purchase is the tax credit is of no value to the city, but it is of value to the person that's leasing it to us. That's how we're able to get that $80,000 discount. I think if we were trying to pay cash directly, we would have to pay the $560. Rather, by taking advantage of the lease purchase, we're able to get it for $480, $800 because of the tax credit going to the people that are leasing it to us. So it's structured as a lease purchase so that they get the advantage of the tax credit, and we share in that advantage and get a reduction in cost. So I think
other questions or comments? If not, are we going to, we need a motion.
This is Councilor Morgan. Move to
Yes.
approval, please.
Okay. Is there a second?
This is Councilor Stout. I second.
All right. Any further discussion? Questions, comments? Okay. Roll call.
Tracy McGee,
Yes.
Stephanie Morgan,
Yes.
Alex Reynolds,
Yes.
Evelyn Hibbs,
Yes.
Jamie Stout,
Yes.
Ivory Van,
Yes.
Marlon Coleman,
Yes.
Deputy Mayor Derek Reed,
Yes.
Mayor Janie Boydston.
Yes, and the motion carries. Item 6.
Discuss and take possible action to fund the City of Muskogee Life and Medical Trust, and if necessary, consider approval of Resolution Number 2810, amending the City of Muskogee, Oklahoma municipal budget for fiscal year 2019-2020, providing for general fund revenues to be transferred into the City of Muskogee Life and Medical Trust, and authorizing the city manager to execute the necessary documents associated with these actions or take other necessary action.
Mr. Miller.
Thank you, Mayor and members of council. You recall last Monday we approved a new insurance plan for the plan year beginning May 1. At that time, you also gave us some direction to see if we could potentially make some changes before the plan year went into effect, and so that's why we brought this back before you today. And so we're going to try and address some of those issues that you raised. One of the questions was a little bit of, we'll probably do a little bit of history as we look to figure out how to supplement the insurance premiums and our insurance plan in the future. So we have an insurance committee. It's made up of good, hardworking employees from all three of our unions as well as some of our non-union employees. They make recommendations. They deal with our broker and advisor on coming up with a plan that they bring to you every year for approval. So for a while, that broker was NFP, and so we had good years with NFP for a while. And in 18 and 19, we actually decreased our premiums that we're paying, which is pretty unheard of because our plan was doing very well. In 19, we even added some benefits. And it turns out that while we were having our good years, we should have been saving more for our lean years instead of cutting back. So what that looked like in numbers is about $40 a month per employee that we were paying less over fiscal year 18 and 19. And in 2020, we went back to our fiscal year 2017 levels. So if you say to most businesses or most organizations that we're paying the same amount for our health insurance in 2020 as we paid in 2017, and we even in the middle of that had 2 years where we were paying less, then you'd say that is good news. That is a good thing. It was probably too good of a thing to be true, and so what we're going to do is have to pay for some of those good years. and catch up. And you take the good with the bad, and so we had some feast, and now we've got a little bit of famine. So here's a look. I've sent the PowerPoint to the City Council, and on the screen, and it kind of details our claims years, where we had a few years where we were kind of breaking even, and in fiscal year 18, we spent more on claims than we had in funding, and then last fiscal year, we came up about $1.5 million short. Not in the fund, but in claims versus the revenues that were coming in. And so that decreased the amount of balance in the fund, and so we started looking to make some changes. And so what the City Council did in February, we hired a new consultant to try and reverse this trend. And so what that new consultant has told us is, we need to look at increasing that balance again. And so the new consultant is called Alliant. They say we need to improve the balance by about $2 million over multiple years, because the decrease happened over a 3-year period. And so the rebuilding needs to happen over multiple years too. Now, one of the things we talked about last week was raising the premiums by $1 million next fiscal year to cover that, and the city absorbing that cost. And that's what the City Council's already approved. But one of the things that was brought up during that discussion is, number one, that since retirees pay what the city pays, that large burden of increase would also fall to retirees. And the second thing the council brought up was that is a big hit to take in one year, $1 million fiscal year hit. And as you know, that when we looked at that, you guys said, bring us back another plan. So this is what we're doing today, is bringing back another plan. And so I want to say that our staff is very creative and smart, and they said, why don't we spread that cost over 2 years instead of one? We had 2 or 3 bad years to get us into this position. Let's have 2 or 3 years to get us back into a good position instead of trying to do it all at once. So they said, we've had, due to the council passing a very conservative budget and staff doing well on expenditures, we have money available in the current fiscal year budget, 2020, that we're in right now, that ends June 30th. We have the money that we could put into the budget for directly into the life fund, life and medical fund, without having to raise premiums. For people, we just make a one-time payment. And then we also phase in premium increases over the next year. And so that's what we have before you, is a way to kind of stabilize the fund with a quick, immediate injection of cash from the general fund, which is what the plan you guys have already passed, through the conservative savings that you guys have put in place through conservative fiscal budgeting, and allowing us to spread that cost over this year and next year, and take away some of the fear that we're having to do it all in next fiscal year when the budget's going to be scary. So what that does is kind of projects us to have to take that $1 million one-time expense this year, projects us to have a cash flow to where we're in very good shape this time next year in this fund, and then we can look at adjusting and adding premiums year to year as we go, instead of leaving them the same for 4 years like we have. So this addresses the issue. It reduces the rate of increase for premiums by 75%. It makes that premium increase 75% lower for people that are retirees on our plan. It saves the city money next year. It allows us to get the fund back where it needs to be this fiscal year. And so that's what the staff recommendation is. And so what you have before you are budget amendments that would allow us to do those transfers and allow us to move forward with that plan. So with that being said, I'll be happy to answer any questions, and staff does recommend approval of these budget amendments.
Okay, thank you. Questions or comments? Motions.
This is Hibbs. I'll make the motion. This is
Okay.
Reynolds, I'll second.
All right, we have a motion and a second. Is there any further discussion, questions, or comments?
Yeah,
If
Councilman
not,
McGee just
roll
want to
call.
make sure. I'm sorry. I just wanted to make sure to staff and Mike Miller that we really pay close attention to our accounts so that we don't run into a major hit of $1 million or $2 million to be funding. And most importantly, even though I know we get information from the broker, we want to be making sure that we fund our accounts to so that this don't happen again. That's all, Councilman McGee.
Thank you. Any further discussion? Then roll call.
Tracy McGee,
Yes.
Stephanie Morgan,
Yes.
Alex Reynolds,
Yes.
Evelyn Hibbs,
Yes.
Jamie Stout,
Yes.
Ivory Van,
Yes.
Marlon Coleman,
Yes.
Deputy Mayor Derek Reed,
Yes.
Mayor Janie Boydston.
Yes, and the motion carries. It's my understanding that we do not have any citizens who have asked to speak to us tonight. So I'll just say that I'm going to be happy when we can all be together again. And I want you all to stay safe, and we are adjourned.